We have another article here in Jacobin to talk about the Biden administration, their ongoing attempts to privatize. Here we go, to privatize Medicare. And what they're doing is classic Democrat. They were busted here, so they're changing their rhetoric, but not changing their policy at all. So it's the performative, fugazi nonsense without any of the substance to back it up, as they often do. This is by Bronco Marcetic. Under pressure, the Biden administration rebrands its Medicare privatization initiative. Rebrands. Not like we're going to cut it out. Rebrands. After quietly pushing an insurance industry-backed Medicare privatization scheme, the Biden administration has come under fire from pro-Medicare activists. In response, the administration has rebranded the scheme, but left its privatization substance intact. Though it sounds unbelievable, the Biden administration has spent the past year advancing a Donald Trump-era program that inserts a profit-driven corporate middleman between retirees and their Medicare, something its critics warn is the first step to the total privatization of the program, and it appears the ensuing battle is just starting. Joe Biden seemed to be dangling a blade over the direct contracting program after a groundswell of opposition among both grassroots activists and progressives in Congress forced his hand. Officials began hinting that they would overhaul the program or even cancel it entirely, with those businesses set to profit from it working feverishly to prevent the latter outcome. For the past week, both the healthcare industry and advocates for public health care have been waiting anxiously to find out what the administration decided. Yesterday, they got their answer. In response to, quote, feedback from stakeholders and participants, the Centers for Medicare and Medicaid Services announced the direct contracting program would be turned into something called ACO REACH, Accountable Care Organization, Realizing Equity, Access, and Community Health. So what they did is they put an acronym out there that sounds somewhat like progressive-ish, and continued the privatization scheme under that acronym. It's classic Democrat. They never think the problem is their lack of action or the substance of their shittiness. They always think it's just like a PR problem. Let's just bring in some PR people. We'll rebrand it. We'll, it's so hollow and vapid. Besides the name change, the administration has offered several reforms. Now those entities participating in the pilot program have to develop and implement a robust health equity plan for underserved communities. There will be more transparency. The CMS is also promising to explore stronger protections against inappropriate coding and risk score growth, referring to the practice of private middlemen presenting Medicare beneficiaries as sicker to siphon off higher payments from the program. So far, so vague. Yeah, guys, they literally they lie about the patients so that they can siphon off more funds between the patient and their care through Medicare. That's health insurance in a nutshell. Most substantively, CMS is now requiring any ACOs taking part in the program, what used to be called the direct contraction entities that would serve as those middlemen, to have participating providers control at least 75% of their governing bodies, compared to the older policy of 25%, and include 2 beneficiary associates with voting rights. The question is this change enough to fix what worried public health campaigners about direct contracting in the first place? The answer, they say, is no. We don't see anything other than a name change, said Diane Archer, president of Just Care USA. The Physicians for a National Health Program, one of the groups that has led the fight against the program, has reacted similarly, with President Dr. Susan Rogers calling ACO REACH, quote, direct contracting in disguise, and warning that it doubles down on the fundamental program at hand, needlessly placing a profit-driven middleman that no beneficiary ever asked for into traditional Medicare. So it really is classic Democrats, you guys. They take criticism of a horrendous policy and they think they just have to rebrand it. And I'm sure to some extent it'll work. I'm sure to some outlets they'll report this as though Biden has taken a better position, right? But he clearly hasn't. And we could go through all the issues where Biden has taken the position on the campaign trail that he knows he needs to take in order to get elected, and then reneged on any sort of promise that he made. $15 minimum wage, canceling $10,000 or $50,000 of student debt. He said he would implement a public option. He could do it via Social Securities Act. He could do it via EO. Because of the pandemic, he has refused. We can go on and on and on. What's the border like compared to the promises that he made? He said he would undo all of Trump's executive actions on immigration day one. He said that. It's been over a year, and he has not removed all of Trump's executive actions. So, like, we could just go on and on and on about this stuff, you guys. And here's another one where he thinks the solution is to pretend that he has changed his position when he very obviously has not. So that's deeply concerning, you guys, because there are already quite a few problems with Medicare in terms of it being undercut and defunded and these kinds of things, to where it cannot be as robust as it should be. And to further privatize it is the exact opposite of what we should be doing as it pertains to healthcare. And to do so on an issue where, like, all the polls I see, you guys, 75 or so percent, mid 70s in any given poll of the country supports Medicare for all. Biden's like, let me run in the exact opposite direction. I'll side with the 20% of far-right maniacs who are going to dig their heels in on this. I'll side with the insurance companies and big pharma. It just... what bothers me so much about it is how that will not affect how he's portrayed in liberal media outlets. He'll still be portrayed. They'll do the false dichotomy thing that I was talking about earlier. Trump runs again, it'll be like, well, Biden's better on healthcare than Trump, even though he reneged on all of his fucking promises and moved things to the right and went against 75% of the country. There'll be no discussion of, hey, maybe you should have followed through on the promise that you have the power to follow through on. None. Zero. And anyone who does say that will be accused of wanting to help Trump, right? We're gonna fall right back into 2020 again, with this kind of rhetoric. So shame on Biden, shame on the administration for not pushing him in the other direction. To privatize Medicare is the exact opposite, precise opposite of what we need in this moment, especially after a pandemic has demonstrated to us just how ineffective our healthcare system is. So, pre-pandemic, you guys, 50,000 people are dying a year in this country, pre-pandemic, from lack of access to basic healthcare, not robust health, basic healthcare. So, for Biden to run in the opposite direction here after the promises he made on the campaign is no less than shameful and disgraceful.